Hello, shalom, people, shalom fans. Good morning to you all. Good afternoon to you, and good evening, depending on the time that you are watching me. My name is Savior Agent, a medical practitioner. So today, I want to talk about the issue concerning our health and what is making us not living so long. So, sitting there in the hospital, we receive a lot of patients, and I look at the patterns of morbidity and mortality, which mean the rate of death, sickness, and death among the youth. So I decided to pick out the few commonest cause of death among the youth. So one of them is hypertension. So I really want to talk about hypertension. At a large extent, it can be prevented. So ignorance is the biggest problem as far as that disease is concerned, because hypertension is silent. When we begin to have signs and symptoms that are related to hypertension, it means we are already late. So it's what we should look closely into that. The heart, as we all know, is one of the vital organs of the body. It begins to beat at the age of 5 weeks. I mean, when a woman is pregnant, the fetus heart begins to beat at the age of 5 weeks, and it beats throughout life. Anything that threatens that beating, if it stops for a few minutes, that will be the end of life. So, very important. And every other diseases that affect the human body that can lead to death, ultimately it will lead to the heart stopping before the patient can be certified dead. So as we get older, from childhood to adulthood, things begin to change in our body that sometimes affect our blood pressure, and the blood pressure many times begin to rise. So as we get older, from childhood to adulthood, things begin to change in our body that sometimes affect our blood pressure, and the blood pressure many times begin to rise. So when the blood gets to 140 for the systolic over 90 millimeter mercury, we say the patient have hypertension. You can have 120 over 90, or you can have 150 over 80. It's still hypertension. You can also have 160 over 80, or 170 over 80. It's still hypertension, but it's when we get to hospital level and scientific level, that is where we will disaggregate it, the figure, and classify it according to the age and all that. It is estimated that between 30% and 40% of Nigerians have hypertension, or we have it. You can have 120 over 90, or you can have 150 over 80. It's still hypertension. You can also have 160 over 80, or 170 over 80. It's still hypertension, but it's when we get to hospital level and scientific level, that is where we will disaggregate it, the figure, and classify it according to the age and all that. It is estimated that 30% and 40% of Nigerians have hypertension. Oh, we have it. So it's very common. What is the problem with hypertension? The problem with hypertension, it means that the pressure of the blood coming directly from the heart is what will lead to what we call end organ damage, because all the vital organs in the body begins to have repercussion on those sustained high blood pressure. And starting from the brain, the commonest cause of stroke is hypertension. So what is blood pressure? Blood pressure is a constant elevation of blood pressure above the normal range. So the normal range of blood pressure is 120 over 80 millimeter mercury, or 140 over 90 millimeter mercury. But when we get to scientific level and hospital level, we disaggregate the figure and classify it according to the age and all that. It's still part of the crude definition. And we find people in that situation even today. If you go around the hospital in Abuja, you will find 2 or more people as a result of that hypertension. You that even go for a random check, it's you that will tell them that, please check my blood pressure, it's high. So it's very common. This is why I say that initially I said it that um, hypertension is silent, and hypertension is by far the commonest cause of stroke. You see, when the blood is sustained in that high very level, the blood vessel on the brain cannot be able to take it. It's like, for example, it's like passing water on a pie with with force. So if it happened to the brain, the hypertension itself is weakening the pie. So over time, the blood vessel will burst. So it's what will lead to stroke. Or blood clot might form and block the passage of the blood, or the circulation of the blood in the body. That thing can also happen to the heart. However, the heart also require its own blood for its own survival through some vessels. If those vessels are blocked, is what will lead to heart failure or heart attack in a layman language. So the heart, the muscle of the heart cannot be able to do its work, so that can lead to heart failure. And with the sustain of the high blood pressure, it can also knock down the kidney, because remember my first teaching about kidney, I made mention of this, that every single heart beating is hitting on the kidney if it is not well controlled, and that may lead to kidney failure, because it has been hitting on the kidney for over times and many years. So in a large extent, that the kidney say, I am tired, and it packed up. The same thing goes to the eyes, because hypertension lead to blindness. It affects the part of the eyes that make us to see. From the vessel is receiving a lot of heat from the hypertension, and over time, if it is not well controlled, over time the eyes will go blind. Lastly, there are many more, but we will talk about that later. So for men who have sustained high blood pressure over time, it makes them not able to perform in the other room. It affects their private part. It affects also the X and the area 1. So it's what you should take charge of your body. This is why I say that you should always constantly knock on the door of your body and ask my body, how are you doing? This underscores the importance of follow-up, right? So it leads to erectile dysfunction. Sometimes you also do it, sometimes it it lead to gangrene that can lead to amputation. So you see, hypertension is very, very bad. Likewise, diabetes. So it usually make the lower arteries of the legs or the hand becoming occluded. So you see, it's very bad. So it's one of the reason um, many in Nigeria do not live beyond middle age, beyond 60 and above, is hypertension and diabetes. So sometimes or many times you hear, oh, the man sleep, didn't wake up. Oh, she didn't wake up. It's hypertension. And most of the time, if the major blood vessel burst, they can't even make it to the hospital. Some are rushed half dead to the hospital. They will put them into a ventilator and they can't also make it. Sudden collapse in the office. Some are even they rush them to the hospital. They are already dead on their way going to the hospital. So that is stroke, and also that is hypertension for you. Sudden collapse in the office. Some are even they rush them to the hospital. They are already dead on their way going to the hospital. So that is stroke, and also that is hypertension for you. So it's very common. So what are the causes of hypertension? Generally, we have two types of hypertension, which is primary hypertension and secondary hypertension. So it's very common. So what are the causes of hypertension? Generally, we have two types of hypertension, which is primary hypertension and secondary hypertension. Primary is the commonest. We call it essential hypertension. So the essential hypertension, which is the primary hypertension, is nobody can tell you that this is the cause, but the risk factors are what will predispose you to it. You understand? And one of the risk factors is increased age in the essential blood pressure. So what we need to look into the essential blood pressure is that our blood, as we are growing older, our blood vessel, instead of being elastic and pliable, but is becoming very hardened for the heart to push out the blood. The heart need more force to push it. So it's why we lead to hypertension. Another factor is family history. So if someone's family have